Hi class, my name is Sumaya Ibrahim and I will present today what I have learned through my reading on mental health and substance abuse disorder. What surprised me through my reading that the number of deaths from substance use disorder is more than the number of deaths from the motor vehicle accident. And the person might develop tolerance to the drug at some point. So at that time, the body will need more drugs to reach to the euphoric feelings or the effect which the patient feel after using the drugs. In case of body tolerance, the body will develop withdrawal symptoms if the person stop taking or discontinue taking the drugs. The use of drugs is a coping mechanism. So sometimes the patient can use it to run away from the stressful life event, which can happen. So what did not surprise me is the negative impact of a drug abuse is not only on the individual, but it is to the community, family, and economy. And early recognition of illness can lead to a better outcome. In addition to that, there is no safe alcohol level during pregnancy. So during pregnancy, it's prohibited for a pregnant woman to use alcohol, and there is no level is considered safe during pregnancy. What I learned from mental disorder is that schizophrenia is associated with a change in the brain structure. Such as enlarge in the third and lateral ventricle, less blood supply to the frontal lobe, excessive dopamine secretion, reduced gray matter in the temporal lobe, and abnormal cells in the hippocampus. Depression is also a common problem, but sometimes mild form of depression can go misdiagnosed by the healthcare provider, so the patient will not get the medical attention that they need. When treating depression, it's not enough to provide only medical therapy, like prescribing medication, but it has to be combined with counseling to provide a total help to the patient. What I have learned from substance abuse disorder, that there is 3 stages that the individual pass through in substance abuse disorder. That is dependency stage, tolerance stage, then the addiction stage. And there are also 2 types of dependency, physical dependency and psychological dependency. The withdrawal symptoms are irritability, vomiting, tremor, stomach cramp, high blood pressure, psychotic episode, and convulsion. It is very important to understand the mechanism of disease process to prioritize the patient care. For example, understanding the pathophysiology could help make the correct decision when treating patient with substance abuse. Knowing that these patients might develop seizures because of sudden stop on the medication, on the drugs, that will make the healthcare provider take precautions to avoid any serious complication. Another example is knowing about the prescriptions, monoamine oxidase inhibitors, and how this prescription is not allowed to be taken with the food that contain tyramine. So that will be very important to talk to the doctor, to talk to the patient about it and educate them regarding the food that contain that tyramine, such as the chocolate, the red wine, beer, aged cheese, to avoid any serious complication while taking this type of medication. I also knew from my reading that schizophrenia has a genetic connection, but the real trigger is for the symptoms of schizophrenia or for the recurrent of schizophrenia is stress. So when the patient pass through stress situation, so all these symptoms will start coming again, even if the patient is under medication. So therefore, it is very important to educate the patient about coping skills, how to, what kind of habit they can adapt to lower the stress level and improve their overall well-being. So the patient can be educated about some kind of exercise like meditation, yoga, even doing walking, some kind of physical activity, having good relationship with the family, with the friends, eating nutritious diet, take adequate sleep, and listening also to music. All that will help to minimize the or to lower the stress level to the patient. The main things that I have also to educate the patient is that recovery is possible. So they don't have to believe that if they have mental illness, that means it is there is no recovery in mental illness. So brain is just another organ in our body. It can get sick and it can also get better. So I believe that the main important subject that every healthcare provider in mental field need to improve is the stigma. Stigma around mental illness is very important. Civil rights issues at our time, and shame and silence will not improve access to the care or improve the quality of the quality of care that we provide to the patient. So thank you so much for watching my video.